You've taken the same medication for years, the same dose, you're going to the same pharmacy, you have the same insurance, and then one time you go in for your refill and the pharmacist says it's not covered. Nothing about your health changed. Something else did though, right? Today we're going to show you exactly what a formulary is and why it's really controlling what you pay. And honestly, I can't tell you how many times I've had this conversation with folks because it comes up all the time. Somebody's going in, getting a prescription filled. They were able to fill it a week before or a month before, and then this time they come in and it's not covered. And it really has to do with the formulary. And the formulary is not really anything. I mean, the insurance companies like to make it pretty mysterious, but it's really not. It's a mystery. It's just a list of what the covered medications are and what tier they're in. You know, there's a lot, you probably hear generics, right? Most folks have heard of what a generic is. And then you have typically your brand name drugs, and then you have what they call a brand not preferred or brand non-formulary. I always tell folks, if you see a commercial for it on TV, it's most likely going to be the highest tier that there is. Nowadays, you see more tiering. You see generics tiered. You see a lower costing generic, a higher costing generic. But the other things to be concerned with is when you go in and you go to get it, it couldn't be as simple, right? I say simple, right? It could be as simple as it's not on the formulary or it just changed tiers. But it could also mean that now it requires a prior authorization. That means that maybe your doctor needs to submit more paperwork for it. It could also mean that this particular drug now warrants what they call step therapy. That usually just means that you need to take a lower costing or a generic drug first. So one of the important things to do is when you are with the pharmacist and they do tell you it's not covered, find out exactly why, because that's going to help you map out the path that you're going to need to take to figure out what your next steps are, right? If it's a prior authorization denial, that's going to take you down a different path than if it's a tier change denial, or that it's just simply no longer covered. So you're going to want to make sure you have that conversation. And then what you want to do is just go online and look up at your insurance company's formulary. You're always going to want to check online because they change all the time. And what is considered a brand preferred drug one day, maybe a couple months now, is now all of a sudden it's a brand non-formulary and you're paying a lot more for it. So the other thing that you really want to make sure you're doing at this point in time too is if your drug did go into one of those higher costing classifications, have a conversation with your doctor. Ask if there's a lower costing alternative for that particular medication. They may actually have one, or maybe there's a generic alternative that you could be taking that could be no to little cost for you. The other point that I want to make is you want to pay close attention to the formula, especially during a period of time of open enrollment. Typically, if your plan's enrolling in January, that's when a lot of these health insurance carriers do make wholesale changes to their formulary. So you could fill a prescription in November, and then all of a sudden you go to the pharmacy in January, and it's not covered. To that effect, too, if you're going through open enrollment with your company, your office, or wherever it is you work, and you're making a carrier change, that is also a period of time where you're going to want to really be focused on that formulary, because going from one carrier to another insurance carrier can mean radical changes in the formulary. But if you're finding yourself confused about this and you just maybe want to have somebody to sit down with and go over everything and help answer your questions, feel free to reach out to us here at Cornerstone Health Advocates. That's exactly what we're here for. Your first consultation with us is always going to be free, and that any future consultations are always based on a sliding scale. Nobody's ever turned away for cost as well. That's part of our mission here as a nonprofit. I have a lot of information down in the description of the video here today, including in that it's just going to be a quick link to our pharmacy guidebook. Go ahead and download that. A lot of what we talked about today is going to be there. Go ahead and share this video. Perhaps somebody you know may be going through some issues. And if you haven't done so yet, please subscribe to our channel. We're posting videos like this on a regular basis. So thank you very much and have a great day.